Hi everyone and welcome to the Mum Bod channel. Today I want to talk a little bit about Diastasis Recti or Diastasis Recti, however you want to pronounce it. I want to talk about it in the postpartum period, so after you've had a baby. Now, first of all, what is Diastasis Recti? Well, the two walls of your abdominals are joined together by a fascia called the linea alba. And through pregnancy, as your baby grows and your tummy expands, the fascia is pretty great. It kind of grows and stretches to accommodate your baby. Now, diastasis recti is that thinning of the linea alba, and it's totally normal in pregnancy and in the postpartum period, so it's not something to worry about. In fact, nearly all women will have a diastasis at the end of their pregnancy, and if you were to check at 6 weeks postpartum, a prevalence of about 60%, and if you were to check in 12 months after having the baby, some studies show there's up to 32% prevalence of an abdominal separation. Now, how is a diastasis measured? Well, we want to be checking the width and the depth, and we can do this with our own hands. Now, you can do this as a self-assessment, and I'll show you how to do it. But if you really want to have the gold standard check, you will be required to have an ultrasound with a physiotherapist. So first of all, you'll be lying on your back, and I'll take you through it in a minute, and you'll be using your hands. You'll want to be checking just around your belly button to begin with. So we'll be checking to see it's spongy, which is great, a little bit like a trampoline, or if your fingers sink right in, because obviously we want to be checking the depth. So you can put your hands in sideways, see how far it will sink in, and we'll be measuring in knuckles. And sideways, we'll be measuring how far apart the diastasis is. So anything above a 2.5 finger width is considered a diastasis. Anything less is not anything to worry about too much, but in that case you might want to check the depth to see if your fingers do sink in which case we can still work on that, or if you're nice and spongy, then your core seems to be functioning really well. Okay, so lying down on the floor, just relax. Breathe in and breathe out. Okay, taking your hand, let's check just around the navel, which tends to be the thinnest part of the linea alba anyway. So we're going to just check, see if it's spongy on relaxation or if your hands sink right in. Without any cueing, I just want you to lift your head and shoulders off the floor and note, what is the width that you can feel of those rectus abdominals? Are they really far apart? Are you getting any doming? Are your fingers sinking far in? Then come back down. Okay. Now, I want you to think about a nice, relaxed inhale. So this is the 360 breath that I've taken you through in other lessons. As you exhale, I want you to lift your pelvic floor. As you exhale, it'll be a nice, strong, steady breath. So that should activate the TAs a little bit more, your transverse abdominis. So, big breath in. Pelvic floor lifts. Strong exhale. Now check with your fingers. Do they sink in and down? And if they do, how far do your fingers sink down? And check the width. How far apart is your abdominal separation? Is it 1 finger, 2.5, or more? 3, 4. Some people, it can be a really big gap. Don't worry if it is. You can still work on making improvements. Now, you'll also want to check just above the belly button because you can have the abdominal separation. It can be just around your navel. It could be at the top more. It could be at the bottom more. It could just be all along. So again, you want to do the same thing. Inhale, exhale, and lift. Record the depth. How far do the fingers go down? And how far is the width? So how wide is it between the two rectus abdominals, which obviously run this way. Back down. Go low again. Just check the squishiness before you go. Come up without any cueing, have a little check, come back down, then you go again. Nice inhale. And then exhale, lift, see if you've got any abdominal separation down below. Now I'm going to attach a PDF with this video to help you record and monitor as you start training for your core. I really hope you found this video helpful. For myself personally, I had a 4-finger width gap after having my twin girls, and I really wasn't seeing any improvement until I learned how to do a self-assessment, which meant I understood my body a little bit more and what was working and what wasn't working. And in some cases, for some of you might find that you need different exercises to someone else. So when you do see a Diastasis Recti program, please remember that it's not a one-size-fits all approach. Don't forget to like and subscribe to my channel as I bring you more fitness videos for prenatal, postpartum, and just general fitness for women.